Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. You know, as usual, I'd like to talk about caring and sharing our med moments. You know what a med moment is. That time when you've had that chest pain, when you're walking up the stairs, it just may reflect that there's something going on in your heart. That time that you have arthritis and it just won't go away, that pain in your knee. Those are the med moments I'm talking about. Those are the ones I want you to email me about. Let me know what's going on out there so that I can take your med moments, reflect them on the show, and we just may be able to help someone else with their health care. Remember, www.medmoments.com. That's www.medmoments.com. Email me. Let me know what's going on out there. Of course, we have a great show. And I have a physician that's here to talk about pregnancy. We're going to talk about everything you wanted to know and maybe a little bit that you didn't want to know about pregnancy. Dr. Yvonne Wright-Cadet. She's here and she's an OBGYN specialist. And basically, and I'm glad that she was able to make it tonight because she just got out of surgery and came over to the studio, and we have her here to tell us everything we need to know about pregnancy. Dr. Cadet, welcome to our show.
Thank you so much. I'm glad to be here.
Oh, we have a lot to talk about, so we got to get going.
Yes, we do.
Now, first thing I would like to say is, or ask, I should say, very basic. What is pregnancy?
Well, that's a good question, and it is a very basic question. Pregnancy is basically the state where a female has a live baby growing in her womb. That's the basic definition of pregnancy, and it actually applies to every body in the animal kingdom. But for women, a pregnancy is a baby growing in the uterus.
Oh, interesting. That is interesting. I mean, I won't go there because I've had several, my wife has had several children, and during that pregnancy, I felt like I was pregnant too. You can believe it or not.
I do.
You do. Tell me, a normal pregnancy. Are most pregnancies normal?
Well, actually, most pregnancies are normal. Mm-hmm. Most of the time, we see pregnant women. They're generally healthy ladies. They generally have a normal pregnancy that lasts about 10 months. They give birth, and everyone's happy. So most pregnancies are really very nice. It's not, what I tell my patients is that pregnancy is an altered state of health. There's nothing abnormal about being pregnant, and people really enjoy their pregnancies, and especially when everything is going very well.
Mm-hmm. Now, I understand the word called high-risk pregnancies, and if you could just explain that for me, because there are some patients that are placed in this category, and why?
Well, there are normal pregnancies, and then, of course, there are some people who don't have normal pregnancies. And we kind of look at pregnancies that are high risk as any pregnancy that has a problem. The problem can be with the baby, or the problem can be with the mother. And those categories break down into a lot of different problems. Some women can have high blood pressure, some women can have diabetes, and then there are problems with the baby. Some babies can have problems growing. Some babies can be born with some abnormalities that started inside the womb. So we categorize normal and high risk, and then high risk has a lot of different categories. And when you come to your doctor, they will ask you many questions, and they will try to decide whether you're a high risk pregnancy or you have a normal pregnancy.
Right. Now, are there certain doctors that may specialize in high risk and other doctors that just do normal pregnancies?
Well, we have doctors who do normal pregnancies. For example, I take care of women who have normal pregnancies.
Right.
And then when a woman develops a problem, depending on how complex or how difficult the problem is, I will decide whether I'm going to continue her care or if I need to have another specialist help me.
Okay.
And then that is how we decide who takes care of the patient.
All
But
right.
usually it's a group of doctors all focused on that patient to get her the best outcome.
Right, right. Now tell me, as far as most of the patients, when they come to your office, do they know they're pregnant, most of the patients? Or are there some surprises there sometimes?
Well, you know what? In this country, about half the pregnancies are unexpected. But out of that group of women who did not plan to get pregnant, there's always a certain number who are really surprised by it. And a lady will come to my office thinking that she hasn't had her period for some other reason. And of course, I do a pregnancy test and she's pregnant. But I would say about 90% of women who are pregnant, they know it. And they already come expecting me to just confirm that they're pregnant.
All right, all right. Now, as far as some questions that you may ask the patient when they first come to the office, because I'm sure they're anxious and it's an exciting time, and you ask past medical history. Can that affect the patient as far as the pregnancy or the baby, as far as what's going on in the past in their medical history?
Yes, absolutely. When a woman comes to the office, and once we confirm by doing a urine pregnancy test or a blood pregnancy test that she is pregnant, then she has a whole series of questions that she has to tell us about. And she probably feels like she's sharing every detail of her life, but that's the important questions. For example, if the woman is a certain age, then she's at risk for certain problems. So we ask a certain list of questions. For example, we may have a lady who's over 35. That puts her in a high-risk category. So we ask her about whether she's ever been to doctors for any treatment for any surgical procedures, any medications, and that slowly breaks the patient down into things we have to check for. So the woman who comes to the office, we ask about medications, allergies, whether she's had any reactions to any medication, whether she's had any surgery, because believe it or not, in these times, many women have previous surgeries and are now pregnant. So we have surgical problems and we have medical problems. And once we figure out what the certain person's problems are, then we can do our best to address those problems and take care of that part of the pregnancy.
Alrighty. Now I understand that things like genetics as well. I mean, in modern days medicine, genetics are a big issue.
Yeah.
And tell me about that as far as what's gone on in your past family history, the likelihood that the baby may have that problem as well.
Well, what we do is one of the types of questions we ask is called a family tree. And everyone knows about when they can make a little diagram to find out what grandma had, what grandpa had. So if we ask about the history of the patient, for example, what illnesses have your mother had, what illnesses have your father had, and what effect that has had on their children, that'll help us to know what to look for.
Okay.
So a very simple example is sometimes a woman will have a baby who was born with a heart problem. And then we're very concerned about the current baby. We do sonograms to see if the baby has any heart problems. So yes, family history is very important because we pass our genetic material down to our children. And so that helps the doctor to figure out what risks you may have in your pregnancy.
Right. What about as far as, I know we had another show and we talked about HIV.
Yes.
But we didn't cover it in pregnancy. Give me an understanding about the mom having HIV and the possibility of passing that on to their child.
Yes. Well, that is a serious concern because HIV is not a deadly disease anymore.
No,
people are living very long with HIV, and especially young women. That's one of the newer problems in the population between 15 to 45. We test everyone for HIV, and women who have HIV, there is a risk that they can pass that on to their child. So women with HIV, we help them by consulting with an infectious disease specialist.
Okay.
We give special medicines for pregnant women who have HIV, and those medicines help to decrease the amount of HIV virus that's in their bloodstream, because anything that's in the mom's bloodstream can go to the baby. Right. So if we decrease the amount of HIV in the bloodstream, we can decrease the chances the baby can get that virus. We also do another thing. When the mother is actually having the baby in labor, then there's other medicines that we give immediately, right then, and that helps to protect the baby even more. Okay. So yes, there is a risk, but with the amount of medicines that we use, the baby really has a very great chance of being healthy.
Okay, you just said something that sparked, and I'm going to deviate this conversation just a little bit. You said that the bloodstream that the mother has connects to the baby directly? So they're sharing everything?
Well, they share many, many things. There's certain things they don't share, but small particles like viruses, HIV, go through the mother's bloodstream into the placenta. The placenta is an organ that the baby actually makes while it's developing, and it filters anything the mother has. It filters good things like food and oxygen, and it also filters some bad things. HIV is one of them. And there's other viruses that also can filter through the placenta.
Right.
So the baby lives off of anything that's in the mother's bloodstream. It's good things most of the time, but every once in a while there's some bad things.
Oh, all right then. All right. Tell me about this. Symptoms that a female who is pregnant may have, just to give her a little hint that this is going on, that she doesn't know what's happening. Like, I'm going to give you one, morning sickness or vomiting. Tell me about these symptoms that may occur.
Yes. That's why most women, when they come to the office, they know they're pregnant because they get those symptoms that if you have a sister or mother, they've all told you about it. Just the classic ones are nausea and vomiting, and that happens in the first 3 months. When a woman gets pregnant, it takes a few weeks for the placenta to develop, but that placenta starts making a hormone, and that's the pregnancy hormone that we can check. That pregnancy hormone gives women the symptoms that cause them to feel morning sickness, not be able to have a good appetite. There's other things also. Women start to get maybe a little more swollen than they expect. That doesn't happen very early, but some women do report that. The other symptoms are the classic one, they miss their period.
Right.
When you miss your period, that's the classic sign. Go to your doctor and get a test.
Right.
In these days, we can actually go to the drugstore and get a test, but we always confirm it just in the office. So those are the major symptoms: nausea, vomiting, missing your period.
All right. Tell me something, because the classic one is pickles and ice cream. What's the deal with this?
It's sort of a myth, but sort of true. I have women who have particular things they love when they're pregnant.
Right.
And that's the pickles and ice cream. And there's some women who hate everything they used to like. It's hard to describe what woman is going to get what symptoms.
Right.
But the taste buds definitely get affected when you're pregnant.
Okay. Tell me, go into a little bit more detail of pregnancy test. I know that now they have all of these little tests that are in the pharmacy, but when they come to your office, what type of test do you do to confirm?
When a person comes to my office and I want to do a very quick pregnancy test, we do a urine pregnancy test. Okay. The pregnancy produces certain hormones that come out in the urine, and if you take that urine and put a little stick in it, there's a chemical reaction that shows, the 2 lines. Right. If I'm pregnant, the 1 line if I'm not pregnant. And that is the simple quick test. Right. That just tells me yes or no. But there's another test in the bloodstream that gives you actually a number, a level of a hormone. And that pregnancy hormone level called beta-HCG, that tells me about how pregnant you are, not just yes or no. So when a woman comes and they're not sure when they got pregnant, that will help me to help them to understand how far along in the pregnancy.
Oh, all right.
So,
I wasn't aware of that.
Those 2 different tests will help to start the pregnancy care and also give me an idea of how far along in the pregnancy the patient is.
All right. Now, I know that a lot of times, being a pulmonologist, I treat asthma and different pulmonary ailments, I should say, and patients who are pregnant. And usually they come in with their blood pressure really low. Is that something usual that you will find in someone who's pregnant?
Yeah. The pregnancy actually causes the blood vessels to relax. It's actually a nice state to be in because the blood vessels are not tight. Tight blood vessels give you high blood pressure. So the average blood pressure we all know is 120/80. So a pregnant woman in the first trimester usually has 120/80. The second trimester, when the pregnancy hormones are really, really controlling her body, and that time the blood vessels relax and the blood pressure can drop to 90/60.
Oh, goodness.
Now, if I walk around with 90/60 or you walk around with 90/60, we would not feel good.
Not at all.
But a pregnant woman's body can adjust to that because they need low blood pressure in their blood stream so that the pressure to go into the baby and the nutrients transfer into the baby works better.
Interesting.
So the body just completely adapts to the pregnancy.
Interesting. Oh, goodness. Now, other symptoms that I heard about, things like constipation, My wife told me about that a couple times. And why does that happen? The patient gets high. And there's some others like heartburn and stuff like that that happens while you're pregnant.
Right. Well, the constipation is a little bit the doctor's fault. We give everybody who's pregnant prenatal vitamins.
Oh.
And in the prenatal vitamins is iron. Yeah. And iron causes most women to be constipated if they're not used to it. So you can battle that very easily by eating a lot of fiber in your diet. Sometimes if that doesn't work, we can give stool softeners, things that will help the stool to stay soft. And one of the most important things a person can do is drink plenty of water. Right. As far as
let's talk about heartburn.
Heartburn.
Yeah.
Heartburn. Yeah, just about to get a little myself there. So heartburn is common in pregnancy because women's hormones that are common to pregnancy actually do two things. One, it causes the intestinal tract to slow down a little bit so they don't digest food as well. Okay. So that's in the beginning of the pregnancy. So we use antacids, the simple things, Tums, Mylanta, over-the-counter things that are safe in pregnancy. The second reason women get heartburn is once the baby gets so big, the baby actually presses up against the stomach and the food can't move as well. Okay. So we use the same treatments and acids in both situations.
Okay, excellent. And I know that they get fatigued as well. As the pregnancy goes along, it seems like, and is that because of the weight and the fluid, or are there other reasons?
Well, there's two reasons. One, before the baby gets really large, it's again hormonal. The hormonal changes in a woman's body are, if you ask a woman how does she feel when she's pregnant, she will describe herself completely different than when she wasn't pregnant. The hormones are outrageous. They really change the way your body adapts to different things. You have a baby that's growing very rapidly and really draining you of nutrition. I mean, babies are wonderful, but they're really parasites. Parasite means that they're growing off of everything you have, the baby takes. That's the only way it can live, and it's very, very good at taking all of your nutrition. So that's one reason. And then the second reason, toward the end of the pregnancy, the weight of the baby is really exhausting. And another thing too, the blood volume, that edema or swelling you were talking about, a woman has an extra pint of fluid in her bloodstream.
Wow.
And that is just weighing her down. So, as I said, some women, they feel great. But some women, they can really, it affects them a little differently.
Right. Eating and what you eat.
Yes.
You're talking about the baby is taking all the nutrients from you. How important is it to eat and to eat the proper things? That's something I wanted to talk about.
Yeah, well, the diet is very important because obviously you need to keep yourself healthy, but now you have a baby who's growing very rapidly. So the traditional diet that we have in America, 3 meals a day, snacks in between to help to bridge that hunger between the big meals, should be based with carbohydrates, protein, and a certain amount of fats.
Right.
We tell pregnant women you are not trying to eat for 2, and you're also not trying to diet. So you should eat a normal, healthy meal. You probably need about another 300 to 400 calories a day when you're pregnant, not 2 plates of food.
Right.
So we try not to have women overeat, but enough that they're satisfied and they're meeting the nutritional needs of the baby. And that's fruits and vegetables, lean meats. We need carbohydrates and then some fats in the diet. So a traditional diet is really a normal, healthy diet, and it's great for pregnancy.
All righty. Obesity.
Yes.
Big problem in this country. Can you give me some idea how that changes the dynamics when someone's pregnant going through the 12 months, 9 months? Sorry about that.
Goodness. Women won't like you if you get another couple of months.
God, please don't do it to me.
All right. Well, the traditional weight gain in pregnancy has to do with what you started with. So if we have a very slim woman, we want her to gain about 35 pounds during the pregnancy. If you have a woman who's moderate weight, so normal weight, we want her to gain about 25. And if a woman is obese, we really tell the patient 10 to 15 pounds for the pregnancy. And the reason that is the more a person eats, really, literally the baby can get larger. And we find that when you have people who are overweight, they tend to have larger babies, and then they have more complicated deliveries. And with all that extra fat tissue and extra weight that you have when you're overweight, the baby can actually use that. So you don't have to gain extra weight. It's actually a good thing that the baby can use the fat in your body in order to grow. So gaining weight has to do with how healthy you are and your weight before you even got pregnant.
Right, right. Now, I know, okay, so we step back now. The patient's pregnant and the baby's doing fine and the pregnancy's going along fine. What are some of the, I should say, triggers that a patient should know about that would make them say, oh, I'm having a problem, I gotta go see my doctor?
That's a very good question, because the body is changing so rapidly when you're pregnant. It's hard to identify sometimes when there is a problem. But here are some easy, common things to remember.
Okay.
One, you should never be bleeding when you're pregnant.
Okay.
If you're bleeding, this might be a problem. So you always consult your physician when you see any bleeding. When you're not in labor, you should not be leaking fluid. That's one of the things you should look for. If water is coming out from the vagina and you're not in labor, something's wrong. Okay. The other thing is pay attention to the baby. If the baby is not moving well, or if the baby was moving and now it's not, that's always a key. And that is one thing I find that women are most in tune with. They're pretty much in tune with the baby. When the baby stops moving, or if this baby's not moving as rapidly, then it's a reason to speak to the physician. Okay. So those are the three things: bleeding, breaking your water, and your baby's not doing what you normally feel the baby doing, are keys to let your doctor know. Then the other half of that is the patient, the mother themselves. If they start getting headaches, if they get colds, fever, anything that would make you go to your doctor when you're not pregnant, you should go to your doctor more quickly when you're pregnant.
Okay.
Because the key is to not let an illness in pregnancy go beyond a certain point, because you can treat things early. You can take antibiotics for a cold. You can take certain medicines that are safe in pregnancy, but if you get things early, you'll recover from them very quickly.
Okay. You just said a key word and brought something else to my mind. Things that are safe in pregnancy. Now, I know that there are things that are not safe in pregnancy. Me, as a lung specialist, I think of x-rays. I don't want to give a pregnant female an x-ray if I can help it.
Right.
But there are other things, and like over-the-counter medicine, and of course drug abuse. Just talk about that a little bit.
Okay. Well, in terms of things that doctors do to the patient. So x-rays, we try to avoid x-rays in pregnancy. That's a good point. We do them when it's necessary. So if the patient has a pneumonia and we have to do an x-ray, we do one. But we do something else. We put a little lead over the baby to try to shield the baby from x-rays.
Right.
There's certain tests like MRIs, CAT scans. So certain ones of those we can use.
Right.
Over-the-counter medicines is very important to check with your doctor. There's certain medicines, cough medicines, that have certain safe ingredients we can use. Tylenol we can use. And there's other things we definitely don't use in pregnancy, like aspirin, or Motrin, or Aleve. Those things for pain that people use all the time. They buy them, it's just sitting in a cabinet. Those things we don't use in pregnancy. Right. Other things that women should avoid is certain activities. We don't really think about that, but if you drive, people don't want to put a seatbelt on. It's very important to use seatbelts when you're pregnant. Pregnant women can't go on really odd rides. You see those signs at Coney Island or wherever? Yeah. Pregnant women can't do this ride. So certain physical activities where the baby's going to be jarred a lot, you shouldn't do. Women should exercise in pregnancy though. But I tell all my patients, exercise, but no high impact aerobics. Right. And then exercising is pretty safe. So all of those different things. Now, this is a generality. Your doctor may tell you there's other things you should or shouldn't do because of your certain pregnancy. So the things we're talking about are general, but there are other little things that your doctor may decide is not good for you.
Right, right. Well, the thing of it is that, and I hate to cut us short, but I'm going to ask one more question, just one more question. As far as, and just to cover things like drugs, illicit drugs, and those type of things. And what about vaccines? Those are the two things I want to cover, and then we'll end up, and we'll have to get you back.
No, my pleasure. For illicit drugs, obviously, you should not be using marijuana, cocaine, all of the things that your mother told you shouldn't use. Right. You shouldn't use, and you shouldn't smoke. Right. Caffeine, which is very commonly, common in our society, we like women to use that to a minimum. If you have a cup of coffee every week, no big deal. But if you're drinking 5 Cokes a day, that's too much. That's too much. Right. In terms of tobacco, I think I included already. That should not be used. And what was the other part of your question?
Oh, vaccines.
Vaccinations. Women should have the standard flu vaccines when they're pregnant. Okay. as long as it's not a live virus. So any live viruses, they cannot be used in pregnancy. But we usually all viral vaccines are now dead virus. So there's no danger to you getting the virus in your bloodstream and transmitting it to the baby.
Right.
So vaccines are safe in pregnancy and they should be used. And other types of things like tetanus, diphtheria, we use those in pregnancy, especially if a woman's injured. So typical vaccines that are not live can be used throughout the pregnancy.
Okay, excellent. There are so many topics that we did not cover, and we will have to get you back because we didn't talk about delivering, we didn't talk about many things.
My
I am
pleasure. I'd be
so
happy
happy that you came, you took the time. I know you ran from surgery to get here, but we appreciate it 110%. Thank you very much.
Thank you.
All righty. I'd like to just take a short moment about and talk to you about and do my little segment. I'll get my paper here. I'll do my little segment as far as let's talk. And I'd like to talk about strokes, okay, the risk of strokes. And we're going to do this real quick because I know we only have a little bit of time left. But factors that can change or increase your chance of having a stroke, things like high blood pressure. If your blood pressure is over 140/90, tobacco use, please. Tobacco use can increase the chance of strokes. Diabetes, hypertension, and things like high cholesterol. These are things that can increase the chance of stroke. In closing, remember, caring and sharing, www.medmoments.com. Email me. Let me know what's going on out there. I appreciate so much all the emails that I've gotten, and that way we can continue to help others. Never institute any change in your medical therapy until you talk to your doctor. I trust each and every one of you continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.